my name's Laura and I head up the Connect team at Coventry City Council. I'm just going to spend some time talking to you sort of how the programme's developed over the past couple of years and how that started to align with some of the work with the HDRC and some of the benefits and some of the challenges of how we've been able to measure impact around digital inclusion as a wider determinant of health. So the first slide, I appreciate there's a lot of statistics here, so I'm not going to go read these out one by one, but really this slide is quite helpful for us to really illustrate, I guess, the complexity of what digital exclusion is. So there's a lot of language people use around what digital inclusion is, digital exclusion is, digital poverty, and even nationally there is no real agreed definition of what digital inclusion is. And the complexities that sit around digital inclusion is that it can have lots of factors that impact it. And often we talk about, being able to access a device, being able to access connectivity, needing support skills, support to be able to access services, motivation, confidence, trust, and all of these being factors alongside lots of different other elements of life that impact how we use and want to use digital technologies. So there's a huge amount around being able to access. We know, particularly in Coventry, there's estimated around 9,000 households will have no device at all in the home, and around 30,000 will just be using a smartphone. We really start to look at digital inclusion more than just accessing a device. So even if somebody did have access to a device, just because you have one smartphone in the house, but particularly if you're trying to access work, if you're supporting children with your homework, particularly if you had more than one child and didn't have access to a laptop, we would still argue that that family would be digitally excluded. So it's really around having enough access to what that family needs or what that person needs. There is also a huge amount of statistics around connectivity, around the amount of people who don't actually have broadband in their own home, people relying on SIM cards, people running out of data. So again, it's not just as simple as having a device. There's the element of connectivity and enough connectivity and reliability of connectivity to do what you need to do. There's also a huge amount around skills. So we know that the digital skills gap costs the UK government around £63 billion a year. It has a huge link around employment, but some of the quite stark statistics around 16% of adults lacking foundation digital skills, and these are basic digital skills. But equally then, again, there's a massive gap around support, so where people can access support to use digital skills. And actually, not everyone is ready to be able to access an accredited digital skills provision. And there is a real gap we see around where people can access those basic soft skills to do the most basic of skills and access basic services as well. And equally, some of the statistics here, when we think about actually how digital exclusion is transient. So as people's lives changes, so does digital inclusion. So somebody could be accessing digital technology, could be using it confidently and it meeting their daily needs, but life circumstances may mean that their health deteriorates, they move into different accommodation, they may lose their job, and this means that could risk what digital inclusion means to that person. So for example, the statistic that 21% of attendance allowance customers said that their internet use had declined in the past year. So it's really important that we think about it in that space. It's not just once everybody's got one of these things, they will then become digitally included. And what's really interesting as well is actually when we think about sort of the intersectionality with other things. So when we think about the fact that 23% of young people who are in receipt of free school meal will not have home broadband, that 37% of people over the age of 65 will lack foundation digital skills. So it's really important we start to think about this more holistically and how it overlaps more broadly around inclusion as well. So what this means for Coventry, we've already talked about the statistics around device access, but you can see that 15% of our residents are in what would be classed as income deprived households, that we have 22,000 households who's unemployed. There's factors around the amount of residents we have in care homes. 22.2% of our households are in fuel poverty, and we can really start to draw a picture around some of the complexities we might experience, particularly in Coventry. So what this means for digital inclusion around health. So just before we start, I thought I'd really like to frame when we think about digital inclusion, how it links to health. So digital inclusion impacts your health directly. So we have seen a massive shift around to digital health technologies, particularly through mental health providers using things like apps, the NHS app to be able to book your repeat prescriptions, being able to book your blood tests, access remote monitoring services. If you're not digitally included, this will directly impact your health. But I think what we're really interested in, particularly with the work we're doing with the HDRC, is around that link around digital inclusion, enabling better opportunities across things like education, housing. And what does this actually mean then as an indirect impact on people's health? So as such, we've been working really closely with both health colleagues and the voluntary sector around how we start to understand digital inclusion as an enabler to better outcomes for people, and thinking about those similarities to some of our communities who are more likely to experience health inequalities are also those more likely to be at risk of digital exclusion. So CovConnects is a relatively new programme. We launched around 2.5 years ago, and CovConnects was really in its essence a response to COVID. So when COVID hit and a lot of services digitalised, we saw, really advances in service design that hadn't been seen before, which a lot of people benefited from, and there was a lot of positives in terms of digitalisation. But equally, what it did show was a massive, massive torchlight in Coventry around the inequalities in the city, around the assumptions we make around what people can access, how they can use it, and then how it links to some of those wider barriers. So when we started to shape this programme, it was really clear to us that this wasn't a skill programme, that digital inclusion was social inclusion. And that's how we frame this. We want all Coventry residents to have equal opportunities to use digital tools, technologies and services in the right way for them. And as you'll notice, we say have equal opportunities. We're not mandating. This is about choice. We want to remove the barriers that people will experience around accessing digital so that they can make informed choice. We're not forcing people to use digital. So when we start to look around some of our core values and principles as a programme, we are outcome based. So again, we prioritise social inclusion, not technology. And what's really important for us is that we're not dictating outcomes for people. We are not tracking our performance against the number of people who've entered employment, the number of people who have completed their essential digital skills. This is about people using digital in a way that's meaningful for them. We are partnership led. This is really, really important to us. So we recognise that digital inclusion is everyone's concern. Everyone should be considering this. And we really wanted to work across sectors to understand both, I guess, the diversity of challenges that we would experience, but also the opportunities around pulling services and partners together to work together collaboratively to this shared goal, which we call CovConnects. And equally, we don't set the agenda. So we follow the 100% digital leads model for community-based digital inclusion. And this really recognises that the barriers around digital inclusion will be very different for different communities, for different services. Therefore, it's really, really not appropriate for us to have a one-size-fits-all approach to this. And therefore, we work closely with services to understand some of the barriers that their residents and their communities might experience, but equally, what are the opportunities, what are the strengths, and what can we do embedded within a service where people feel trusted so that we can mitigate those digital inequalities. We have a strong research focus, which I will start to move into. We feel it's really important that we're gathering evidence around this. I say this a lot, but inclusion feels good. When you give somebody a device, it feels good. But actually, how do we know what the programme is doing is actually making impact in the way we want to? Are there ways we could learn from what we're doing? Is there ways in which we could share best practice? So it's really important that we are measuring the impact we're doing and challenging how we do things to make sure we're improving. We're efficiency driven, so we do recognise the challenges around funding. There is no central government funding as such yet for digital inclusion. There has recently been a digital inclusion action plan produced by DCIT, which is a huge step forward for us. The previous strategy was over 10 years old. But equally, so for us to move forward, we have worked closely with other services to understand around how digital inclusion can enable their goals to enable us to access funding. So things like accessing health inequalities funding. We've also accessed things like sustainability funding, employment and skills funding. Again, mentioned, we recognise community differences. We're really passionate about this. The barriers that potentially residents who might be experiencing street homelessness or facing addiction will experience around digital exclusion will be really different to somebody who may be living with dementia in a care setting. So it's really important that we understand and make sure that our solutions are person-centred and holistic in that setting. So the programme has grown at quite a fast pace since we launched. So one of the main things we've done over recent years is start to create a scalable core offer. So I'll go into that in terms of some of the training we offer and the device bank that we offer and some of the supports we have around connectivity. But I really wanted to reinforce that I think what's the beauty of the programme is around the approach is that there is an ecosystem of activity across Coventry, which really is not necessarily led by the council. It is led by the voluntary sector, it is led by the NHS, it's led by the universities, it's led by the private sector. And that ecosystem is what's really, really important for us as we move forward. So just to sort of give a quick run through around what we've achieved as an ecosystem. So this is not just sort of from the council, this is from the partnerships that we have. We have a CovConnect device bank. So this is a way in which NHS services, local authorities and voluntary sector can all apply for a digital kit to use in embedded digital inclusion activity within their services, within their community. And the device bank has now distributed, I think the latest stat was 4,200 devices since it launched around a year and a half ago. So it works at quite some pace. Our newest partnership is around that we lead the device bank, but we work closely with the university for work around evaluation, and we are working with the NHS around reusing their end-of-life corporate devices, but I will come to that. We also have 150 voluntary organisations in Coventry that we work with, which we're really proud of. You can see in the top right, that's the CovConnect map, which has all of the community-led activity that partners are happy to share, sometimes activities embedded within services, so it's not necessarily appropriate to put on the map, but this is mainly activity that residents can access easily. There's 105 digital inclusion hubs in Coventry. 63 of those will distribute SIM cards, which means a resident can go in and ask for help with connectivity and they'll be gifted free of charge 6 months worth of data, texts and calls. To date, we've distributed across Coventry over 16,000 SIM cards. We also have 3 bespoke digital inclusion networks across sectors, which is really, again, pulling together best practice for older adults experiencing digital exclusion, homelessness, and then newly launched an ESOL digital inclusion network. We have our own embedded digital champion programme where we train frontline workers around the barriers around digital inclusion and exclusion, really to enable them to think about how they can support people in their services, but equally as well to understand what the wider Coventry support offer is. We have 155 programmes specifically focusing for young people. We have 10 live research projects at the moment, and we do have quite a strong focus around health, which I will come into. So starting to look at, I guess, what sits behind this in terms of the breadth of the activity that's happening across Coventry, across all partners, sort of chose a couple of programmes that should sort of help demonstrate this. Tomorrow we are going live with Jangala and Virgin Media around our partnership and pilot that happened in Coventry over the past year, where we've connected 200 households in temporary accommodation across 12 partner organisations, looking around what was the impact of connectivity within a temporary accommodation setting. There was research and evaluation that sat alongside this, which was really impactful for us to understand the difference between being able to access unlimited data and capped data, and actually seeing how that impacted around people, how they access services, how it impacted them as people, and equally in different settings, so with different charities. Again, this is really important for us to understand, thinking about temporary accommodation, thinking about housing, what's the role of digital in terms of that as a wider determinant of health. We work with Coventry Family Nurse Partnership, which is specialist health visitors and community nurses who support young mothers, mainly under 19 but up to the age of 21. And they spoke to us, and this was a couple of years ago, approached us around what did this mean for them, what could they do? And they talked to us about meeting mothers in McDonald's to use free Wi-Fi, some of the challenges around some of the maternity support services that they access being online, wellbeing activities, being able to access things like Healthy Start vouchers, all relied on digital access. So we've worked with them to gift connectivity and devices to young mothers who need it, as well as part of the wider maternity services that they access. We work closely with West Midlands Police and Domestic Abuse Support Service charities in the city, and this is for us to enable to gift smartphones and SIM cards in safe settings, to make sure that anybody who is in those settings who needs access to a phone and a SIM card for a whole wide range of reasons is able to access that without question. So it's really important for us that we're embedding the device bank activity within where people need that support. Equally, we've done quite a lot of work with loneliness and isolation for older adults, working closely with the voluntary sector, and again listening to what's needed in a community setting. And this programme in particular, we actually put out to partners and said, we'd be really interested to see if we could give you some funding. What could you do to reduce loneliness and isolation with a digital innovation? And as you can see, the breadth of activity that came back really shows that there is not a one size fits all for this, to make sure that we're really tackling digital exclusion, but also being led what motivates people. So from that, we've got everything from dementia friendly skills sessions, an interactive art studio, an assistive technology suite, and a smart device project. And then equally, I'll just quickly sort of run through these. We've done quite a lot of work around trying to be responsive as a network. So when the prescription ordering direct service closed in Coventry last year, the network was able to respond not only to offer support to residents, but equally we work closely with primary care, with other council teams such as libraries, with community organisations to upskill people around accessing the NHS app. But equally, we worked closely with the NHS to help improve the ways that they talked about how you would onboard somebody to an NHS app, some of the challenges people experience. I'm really trying to take that approach from both sides around upskilling people, but equally raising awareness around the barriers. And actually, there is not a one size fits all. There's not just a digital only approach to this, and linking it to some of the wider inequalities. We've worked closely with organisations like Watch, who've accessed funding to create their own digital health offer and have now accessed further funding to have their own digital divide digital inclusion programme. So it really is about us working with partners to strengthen that community-led approach. We also have our embedded digital champion programme, and again, this is something that we can tailor to audiences. We can train frontline teams to talk about, well, what does digital inclusion mean if you're supporting people who are experiencing homelessness, and we would tailor the training for that. Or if we're working in a care setting, we could do so. And this is really important for us to make sure that actually digital inclusion is everyone's responsibility, and there are opportunities to remove some of the barriers in every service, in every area, in all organisations. And then just recently, we were really lucky to be supported by our own internal skills team to access UK SPF funding, to which we've now got quite a substantial amount of MiFi dongles with data which are going to be accessed via the device bank. And this is really important for us to build on that principle that actually we do not see connectivity as a luxury. We see this as a basic human right in a very modern world to be able to access services. So the device bank has really been quite a key vehicle for us to be able to work in such a small team but at scale. So the device bank has been designed in a customer relationship management software. The team do support people who cannot apply online. We appreciate the caveat of having a digital inclusion initiative that's only online. But really, this was important for us to be able to make sure that we could understand who was using the service, so we could monitor it for sort of a reporting and governance perspective. We could see what areas of the city didn't have very many initiatives, what areas in terms of communities of interests. Do we see that there are very few services supporting people experiencing homelessness accessing the device bank in a way that we could be proactive, but equally the fact that we could speed up the supports and add on additional supports to providers in terms of things like accessing training, and this could be automated through the process. But really early on, we were really keen to sort of explore, actually, we know that there's a massive challenge nationally around digital waste. We know that people don't know where to get rid of kit once they've bought new, or particularly for large businesses, once they've used, it's become the end of its corporate life. So we started to work with the Independent Climate Change Board and the University of Warwick and our own internal sustainability colleagues around what would this look like if we started to see how we could reuse digital equipment. We've got a massive digital waste problem, we've got a massive digital exclusion problem. How could we use both in tandem? So we launched the device bank in June 23, and this was built upon circular economy principles, where we were reusing end of corporate life Coventry City Council kit. We then got a second boost from the Combined Authority Connected Services programme, which really gave us a massive boost. It was quite a substantial amount of devices. It was new devices, which created, a huge amount of interest and activity in Coventry. But for us, what we saw was actually the more we start to do, almost a level of dependency. We're supporting these organisations. They've started these initiatives. We want to make sure that we can continue to. So late 2023, we pulled together the Digital Reuse and Repair Proof of Concept group, which was across the NHS, the University of Warwick and the Council, to start looking around what some of those opportunities might be. And as such, from that now, we've accessed funding from Virgin Media, O2 and Hubbub from the Time After Time Fund. And we are now we're about halfway through our proof of concept, where NHS end-of-life corporate kit is repaired and reused through the device bank and distributed back out to residents by community organisations, NHS services and council services. So what this looks like, so it's really difficult to talk about the device bank, and sometimes particularly we get lost in the numbers. It's 4,200 devices, or it's this many number of connectivity devices, but I think sometimes a case study just helps to draw actually the wider supports that Cov Connects and partners offer to people who are accessing that support. So Sri Mandata are an organisation who came back to us really quite early in our device bank journey, and they talked to us around that they were supporting some residents in a community centre in Folesland and Coventry, and were using their own personal smartphones. They were using the connectivity of their smartphone to hotspot other devices, but they had residents who wanted to learn more about digital, but they weren't really sure where to start. So we encouraged them to put in a device bank application, and one of my team actually spent quite a lot of time going there once a week and just talking to residents for about 6 weeks, just starting to understand, what motivates the residents, what were they interested on, what also were they not so confident about, what was worrying them. And they started to put a very informal support programme together. We brought in corporate volunteering through Virgin Media, who did training around things like NHS app, because a lot of people were interested in it. There's a lot around online safety. And then equally, the team trained the community organisation around to become digital champions so that their confidence grew as well. What this grew into was that we were able to access further support for them through another private sector partner, the Sky Hubs programme, where they were able to access broadband and a tech package. And equally then further funding through UKSPF to be able to almost create the infrastructure for the community centre as a digital hub. They are now working with adult education, and the residents are now accessing accredited skills within the community centre delivered by the council's adult education team, and now devices have been gifted to those residents who attend. So when we first started with that organisation, it was a journey, but when you can see being led by the organisation, by their strengths, and building on that, where you can actually get to with the device bank. And I think for us, we sort of see this opportunity as it's so important that the wraparound support that the team provide and the partners provide is really important to support organisations on their digital inclusion journey, as well as the residents. I'll just pick a few of these just because I'm conscious of time. I wanted to choose a couple of examples of how we really wanted to demonstrate that device bank creates better outcomes for people that are really diverse, and this is why we do not mandate what people use devices for. Equally, before I even go through this slide, I would really like to caveat this, that none of this would have happened without the skills, the investment, the expertise of those organisations delivering the initiatives. If we distributed devices out, they would not have the impact like they do through the partners, where they are embedded in wider supports. So I think it's really important we acknowledge and credit the organisations for that. So, for example, the first one was around somebody who was being supported by a specialist mental health service, and they were literally just giving a smartphone as part of their wider service. And for them, it was the ability just to talk to their mum who didn't live close, and it evoked a very, very powerful emotional response to that person who needed to be connected to people, which really starts to make us think. Often when we talk about digital inclusion, people talk about employment, they talk about jobs. For us, it's really important we think about this is about connecting people. This is about a broad range of outcomes for different people. We have an example there around somebody who came to Coventry during the Homes for Ukraine scheme, and they were midway through their equivalent of the GCSEs. So they were gifted by a partner a laptop to enable them to continue their studies remotely, but equally also be able to access education in Coventry, and they went on to achieve really well in terms of their grades. We've got examples around somebody who was being supported by a caring organisation who'd had to give up work, and was supported by a device as part of their wider provision through the programme. And they were able to start looking for remote working opportunities, connect with services, and reduce some of that pressure from having to give up their job for caring responsibilities. We have an example here around somebody who was a survivor of modern slavery, was being supported by specialists who started to notice that behaviours and almost the interactions around the phone showed a level of concern around actually maybe that the phone was being monitored. They were able to intervene and distribute a phone via Cov Connect, which meant that that person was able to access secure support, safeguarding and accommodation as well. And then, talking about young people, we've had lots of programmes which support people around who might have been disengaged of education, trying to get them interested in digital careers, looking at things like coding, podcasts, being able to use it for digital media. The benefits can look different for lots of different people. So thinking about it in terms of how we measure the impact of this, one of the biggest challenges we have is that it's very difficult to measure and accredit impact for digital inclusion. One, digital inclusion literature is very emerging, so there's not a huge literature base. Two, local authority-led digital inclusion programmes are very new, so there isn't a huge amount, again, for us to be able to benchmark across, and it's a common challenge we see across sectors. So about, I want to say 2 years ago, we were approached by University College London and Leeds Beckett around looking at how we might produce a theory of change and evaluation framework for local authority-led digital inclusion programmes. And this was a point where we'd been working really closely with the 100% Digital Leeds programme, who at that point I think had been established for around 6 or 7 years and were very much seen as the most leading local authority in this space. And then equally us, who had probably been live for about a year at this point and were following their model at this point very, very closely. So the two cities worked together around sort of looking at some of the similarities and some of the challenges and opportunities. It's really safe to say that it generated more research questions than it answered, which is not a negative. I think it's really positive, and it really started to give us some direction in terms of how we would move this forward. Some of the real challenges that we identified were mainly around, the diversity of metrics. When you can see the outcomes, how can you can't standardise across the programme a measure that would look at all of these. Equally, there's a lack of complete measures to be able to do so. It's also very difficult, like I said, around attributing cause and effect. It's really important that we ensure we acknowledge that actually that wider support that might come from. For example, if we think of the Carers Trust example, that the impact that Carers Trust had for that individual, how much of that was related to being digitally enabled, and that's very difficult to quantify. Also a time delay. So when we think about the young person who was able to complete their equivalent of their GCSEs from the Ukraine, there would have been an immediate, you could assume, boost in sort of well-being, educational impact, skill level, but actually what's the longer term impact for somebody who was able to complete their education? So that time delay also makes it difficult. And then equally the scale of data collection, the amount of different partners, and I think this is something we've always been really keen on, is we really don't want to put any barriers in place, particularly for our voluntary sector partners to engage with us. Therefore, we don't mandate burdensome evaluation. We try to make it as easy as possible to work with us, and we'll work with the organisation to capture qualitative data where we can to ensure that it's not a barrier for them to work with us. So some of the recommendations that came out was that we could look at digital inclusion as an intermediate outcome. We do see digital inclusion as an enabler for a better opportunity, but actually there is merit in us measuring digital inclusion as the outcome to see, I guess, progress, how the programme is developing. Also trying to counter some of the challenges we had around standardisation of measures was looking at things that, standardized measures around quality of life, looking at power and control as ways for us to benchmark the progress that we're making in terms of at an individual level. But then equally, we could look at organisational outcomes and see if there were shifts in behaviours and trends. It was also really, really clear that you shouldn't underlook the power of qualitative data and case studies around what that means to really tell the story around what digital inclusion means. And then equally, looking at more robust evaluation designs and evaluation led at a programme level was something we've started to explore. And for us, this is where the HDRC has been really, really valuable for us to be able to progress this, and we simply couldn't have done it without them. So where we are now, we are beginning to formulate our evaluation framework, which sits across 3 core pillars: social, environmental and economic. And from a social perspective, we are looking at both quantitative and qualitative data. So we are working with the HDRC around individual survey design, how we can work with partners to standardise that, but equally how we might standardise our case studies, how we collect them. Some of the challenges we found around case studies is often we will get quite anecdotal that, this device has meant this person's been able to access remote shopping, for example. But what we really want to do is be able to look at that case study formula to almost include prompts and questions to understand, well, what did that mean? Did that mean that that person had more autonomy? Did that mean that I had reduced travel costs? What was the real benefit that came from that as well? But equally, we are trying to keep pushing that the outcome we're looking for is improved quality of life, to standardise again as much as possible across the programme. Environmentally, we're tracking the impact we're having around digital waste, so a reduction in digital waste and reducing embodied carbon emissions from reusing rather than buying new. And this is with Warwick Manufacturing Group, who have designed us a carbon calculator which helps us track at an individual device level. And then equally, again, I'll work with Warwick Business School around understanding the return on investment. So there's lots of national data, often quoting around a £9.48 return on investment for every £1 invested in digital inclusion. What we're starting to look at that is at a much more local level in Coventry to be able to quantify some of that return on investment and again understand what that means. Really seeing this as an enabler for our own council strategic ambitions around being an enabler and a financially sustainable model. So this is my last slide, and then I will take some questions if there are any, but I thought I would just take some spotlights really around how the HDRC has helped progress us thinking in that space of being able to measure and understand digital inclusion as a wider determinant of health. So 2 of the digital inclusion coordinators in my team are funded by the HDRC as research associates. They've been able to integrate research into projects, create networks, build partnerships. There are a huge amount of in-process funding applications, and again, we're spotting opportunities all the time. And this for us really was to be able to be increasingly transparent around what we're doing as a small project team with partners to enable us to be able to identify similar researchers who might have an interest in this, for us to be able to improve our understanding of the effectiveness of what we're doing, but also sharing best practice around the impact of what we're doing in Coventry. And from that, we have a secondment coming to us shortly from Coventry University, and this will be a focus around looking at bringing together both our older adults and young people work streams, really looking at that collaboration around actually how the impact of digital skills development with the support of young people for older adults, and what's the impact for young people around working with older adults around life experience, companionship support, and looking at this as a sort of a multi-generational learning programme. We have a number of different workshops across sectors, particularly around digital literacy. So again, there's a lot around access, but equally there's a lot of inequalities around how confident and the skill level of people using technology. So one of the workshops with University of Warwick and Cov Connects is particularly looking at around how we engage young people to navigate the online world, and it is a co-designed workshop really to get young people to think about things like critical thinking, fake news, AI, and being able to navigate that, and that's delivered in schools and with community partners. We've also just gone live with a funded programme through the HDRC working with University Hospital Coventry and Warwick and the University of Warwick. And this is around understanding digital health literacy. So there's a huge amount of health misinformation online. There are also some benefits to accessing health information online. And this is a collaborative programme around upskilling our voluntary sector partners around some of the benefits, some of the risks, being able to develop healthy communities. And then finally, just to sort of give, I guess, again, the breadth of the activity that HDRC is enabling, we have a programme currently funded through the Policy Support Fund. And this is particularly looking at the social return on investment for digital skills programmes, particularly looking at newly arrived communities in Coventry, and looking at the impact around digital skills progression for things like their employment, well-being. And this really has an overall aim to be able to lobby for policy improvements around access to digital skills provision for newly arrived communities, again, with it being evidence-based, to help shift some of the challenges we see around access to that provision.